Okay, colleagues, good morning from Accra, Ghana. It's afternoon in Cape Town, South Africa. And I'd like to welcome everybody to the African Vaccine Manufacturers webinar in conjunction with WHO. Let's have a sound check. I hope you can hear me loud and clear. Melissa?
Can hear you, William.
Very good. I'd like to introduce Farah Lospa. Farah Lospa is the chairperson of the African Vaccine Manufacturing Initiative. I serve as executive director, voluntary position. We're all volunteers, helping to bring together a group of vaccine manufacturers in Africa striving for sustainable vaccine manufacturing in Africa. I think the timing of this webinar today is really good, coming on the back of the successful meeting that we just had in Abu Dhabi, organized by the WHO Local Production Group. We also had a very interesting convening by the regional vaccine market collaborative, which brought together various regional perspectives on vaccine manufacturing. So today's webinar, which has our group colleagues from WHO looking at market information for vaccines, is really very important. And I think without further ado, I'll invite Tara, Georgios, and Adam from WHO to take the floor and tell us what they want to tell us about. I think we will have the very simple rules. We will have Tara and Georgios outline what they would like in terms of the data information they would like to gather from the vaccine manufacturers and colleagues. And then if there are any questions, further points for clarification, we can invite those. Please don't hesitate to put things on the chat. Melissa will be monitoring, and then we can have it there. Okay, so Tara, over to your team.
Thank you so much, William. Hi, everybody. Good afternoon. And thank you so much, William and Farah, for helping us organize this webinar. We're deeply appreciative from WHO, and we're really excited about starting this collaboration with AVMI and relevant member companies to make sure that we can capture a holistic and full picture through the WHO MI4A initiative. And now, before I kick off, I'd just like to also ask Adam Sobel to please introduce himself, and then I will introduce myself and kick off.
Thanks, Tara. Good morning, good afternoon, colleagues. My name is Adam Sobel. I'm a part of MMGH Consulting. We've been working with WHO to support vaccine policy and market access efforts for a number of years now, and it's great to be speaking with all of you today.
Thanks so much, Adam. Great. So I will give a presentation today. Unfortunately, my team member, Georgios, couldn't. Oh, I see Farah has her hand up.
Farah, hi, sorry, Tara. Hi, Tara and Adam and everyone. I just wanted to share that Tara and I connected last year during the UNICEF Copenhagen meeting, and Tara shared some of the great work that this team in Global Access is doing, and really a lot of the market and data information that informs the SAGE positions on sort of vaccines and biologics. And so I thought it would be really, really useful for us to start having conversations and to start being part of the work that Tara and her team do for DCVMN, for IFPMA, and now they would like to also involve African current and aspiring vaccine manufacturers, which could only be beneficial for those of us who are currently vaccine manufacturers, but also for those of us who are aspiring to be. So I just want to thank Tara and want to share that I think it was a little bit short notice from our side. So what we'll do is we'll circulate the webinar recording to the rest of the AVMI members. And then also, Tara, in the coming 2 weeks, we are having a broader AVMI market webinar where we'll also share the data and some of the points that have come up. And so that hopefully in the next version, we'll have a larger attendance. So just want to thank you. And I think this is the beginning of the journey. Look forward to your presentation. Thanks so much.
Okay, so Tara, would you like to have an idea of people who've joined, or we should go ahead and have the presentation now and then people can introduce themselves later on if they have comments? What would you prefer?
You know, I think we're not too big a group where I'd be very happy if colleagues would like to introduce themselves. That would be very nice.
Okay, good. So please, very quickly, MS, I don't know who is MS. MS is Melissa, yes.
So good afternoon, good day, everybody. I'm Melissa Scow, and I'm the Executive Administration Officer for the African Vaccine Manufacturing Initiative, and I'm based in Cape Town. William, this is a webinar setting, so I'm not sure if everybody will be able to actually, we'd have to give them permission to unmute. Yeah.
Okay. All right. Okay. So the way it's set up, then we will just proceed. Please write your names and where you are from in the chat box, and then we'll have a list of those who have joined, and your questions that also can come through the chat box. Okay. Let's go ahead, Tara.
Great, thank you so much. So I'm assuming everyone can see my screen. Let me see if I can full screen it. Okay, that's better. So first of all, let me take a minute to introduce myself. My name's Tara Prasad. I'm the team lead for Global Vaccine Access at WHO's Department for Immunization, Vaccines and Biologicals. My team leads our work related to global vaccine markets, access, market shaping, supply, and market intelligence. And we also have work streams on supporting country decision-making and financial expenditure on immunization. But the focus of today's session will really be on the market information for access work stream, which is called MI4A. Now, in terms of the agenda, I will give you a presentation. Because we haven't engaged with all members on this call, we thought we'd take a step back and also share a little bit with you about what our work is, what we're doing before we actually go into the data collection process. And then Adam will walk you through the template that you should have all received, and then we'll have plenty of time for questions and answers. So just, again, taking a step back, so WHO has a mandate to support global and equitable access to vaccines. I mean, this is captured in all our work plans, but also some World Health Assembly resolutions, for example, the one in May 2019, through which we adopted a roadmap on access to medicines and vaccines. And there was also a call for WHO to support greater transparency on vaccine markets, including price transparency, as well as on demand and supply. So really, from WHO's perspective, we influence vaccine demand and supply through several different parts of the value chain. We set the immunization agenda, we set the immunization research agenda, we develop target product profiles, we set policy guidelines, and we develop market analyses and access strategies. And you can see here, this is just illustrative, some of the key areas that we work on from WHO HQ, I should say, because of course, our country and regional offices have a much broader network to support countries' implementation on immunization. So we've led the IA 2030, Immunization Agenda 2030. The MI4A piece is what I'll be speaking to today. Through SAGE, we also develop policies, which again guide countries on vaccine introduction and target populations. We promote research and innovation and identify unmet needs. And then, of course, through departments even outside of the one I sit in, we support regulatory and pre-qualification, and we do convene member states and provide technical support to regions and countries. And of course, very happy to say that the pandemic agreement was finally agreed after many years of work. Actually, used to work on it myself from UNICEF's perspective. I was in UNICEF before WHO, so really very excited at this great development that we've seen in WHO. Now, just to dive into the market information for vaccine access initiative, this was launched in 2017, again, building on, a history in WHO of trying to understand different markets and also different sides of the market and the role of different stakeholders. So for MI4A, we have 3 key areas of work that we focus on. One is, of course, to understand vaccine demand, supply, pricing dynamics, and to use that information to identify access barriers and risks. The second is to also convene global health experts and partners to help develop strategies and guidance on risks and opportunities to access. And the third is to support national and regulatory capacity for improved vaccine access. So every year we do publish a set of key market intelligence products. And they vary slightly every year. One of the things that we publish is the MI4A public vaccine purchase data set. And that is actually just an Excel file that lists countries, vaccine purchases, and price and volume for every country globally that reports to us, because we have all our member states reporting to us through an electronic survey. And so in this data set, we do anonymize country names to respect confidentiality, but we think it's a really important piece of information, especially given that, outside of PAHO, Gavi, and UNICEF markets, there's a lack of information on vaccine procurement and pricing as well for other countries. The second is every year we do an in-depth market study. So to date, we've actually done 12 studies, and you can see that they're antigen specific. So there we deep dive into the supply forecast, demand forecast, affordability analyses to really understand the current state of play of a specific vaccine market, including all the suppliers and products, and then to forecast, what's going to happen in the future and what actions the global community needs to take to improve access. So last year we did one on RSV, which was quite interesting. And we also traditionally release a global vaccine market report. And I think that's the one that I think Farah and William find quite useful, where we actually aggregate across antigens and produce information about global supply trends and market trends, including all supply globally.
Tara, your screen, we just have just the face, nothing is moving.
Interesting. Okay. Sorry, I was moving the slide. Oh, sorry. Gosh. Okay. So you've missed that one. I spoke to this one. This showed our role across the value chain. And of course, we can share the slides afterwards, but I won't go back over them. And then this is the one where I was just presenting the 3 key areas that we work on, as well as the specific products that we develop every year. I'll pause for a second and then continue to move on. Sorry about that. Okay. Now, one of the other things to note about WHO's role, because of course we work closely with lots of different partners, is that we take a global perspective. We know that in essence, of course, vaccine procurement and manufacturing happens in specific countries and also regions, and a lot of the market shaping and aggregation happens at country or regional level. But at the same time, we think it's really important to consider the whole world, because we know that there are huge interdependencies between demand and supply from a country, from a manufacturer to the rest of the world. And so you can see that, of course, as we all know, vaccine markets are quite segmented between different procurement channels. And also through that influences, whether countries procure themselves or through a procurement agency, what supply is available to them from which manufacturers at what prices, and also whether they have co-financing support, for example. And likewise for suppliers, depending on what channels they offer their products through, their decisions on pricing, allocation, distribution may vary. So for us, it's really important to look at the whole. Now, in WHO, of course, the work that we do on access and thinking about WHO's broader role is really to develop global public goods. And that's why I spoke to some of the market intelligence pieces that we develop. It's to influence partners working in the ecosystem. And that includes influencing you, suppliers, influencing member states, and influencing other market actors as well. And then, of course, it's also to provide direct support to countries and regions, which is really key, and to represent WHO in global fora. So we work in an ecosystem, and what we're trying to say here is some of the work that we do and how we engage with others. So a lot of the work in MI4A, like Farah mentioned, is also to inform WHO's own internal work, to ensure it's informed by evidence-based market information. So again, we help decide or determine what the big barriers are on supply for the IA 2030 agenda. We present market information covering supply and demand to the SAGE working groups and at SAGE sessions to make sure that the policy decisions are informed by an understanding of market dynamics. We help support early access, especially where there are unmet R&D needs. For example, I'm leading the WHO's TB Finance and Access Working Group, even though the products are still in the pipeline, to make sure that access is considered early on and influenced. And we also work with the PQ team, for example. Their prioritization framework uses market information as one criteria. And then we engage with manufacturers, both through industry associations, such as IFPMA, AVMI, DCVMN, and also bilaterally, depending on on the manufacturers. Sometimes manufacturers reach out to us to discuss challenges or how WHO can support. Sometimes we engage through the Gavi Alliance, or sometimes we reach out to manufacturers on specific topics. We're always open to that. We're also open to having discussions, through the industry association with a group, for example, at senior leadership, to share what's on our mind on vaccine access at WHO, and what's also hear from industry, what's on their minds. So far, that's certainly something I'll take up with you going forward. And then we engage with all the other market actors, again, trying to support or influence them. We're part of, Gavi's market shaping group. So WHO always tries to represent the WHO position there and make sure that it's informed. And then we work directly with countries. And of course, countries can use the market intelligence to inform their purchasing, negotiating, introduction and switching decisions. And then that's really what it's there for, to empower them and everybody else. And we've also been supporting the regional manufacturing efforts through providing technical input, for example, through Gavi's AVMI initiative. And we look forward to contributing to that agenda and also working with you. And then, we also have a role in advocacy when we see challenges to make sure that we publicize them. So just to give you a sense, I think what I wanted to flag is that to make sure that we have a comprehensive data set, we're not just collecting data from industry, but also from countries, right? So that we can see both sides of the coin. So actually, as I mentioned, through our electronic survey, we collect data from, actually last year it was 169 countries, which is really key because, of course, through that we get information on what countries are buying, including which products, from which manufacturers, and at what prices and volumes. And you can see that we really actually have on our website, you can of course download it, there's a link in the slides, sort of a historic overview from 2005, basically, of product purchases by countries, where the country is anonymized, but you can see the region and also the income level and the procurement channels. You do get quite a lot of information. And through that, we're also able to give a broader picture about vaccine pricing as well, which many find quite useful because we go, as I said, into also non-Gavi countries and self-procuring countries. On the other hand, we've also been collecting data from industry for a long time. And with that, we're very excited to now engage AVMI to make sure that we capture the full picture. So we've been sending out annual surveys to manufacturers to collect information related to their portfolio of products and their pipeline as well, to better understand manufacturers, both their available supply for commercialization, as well as the volumes that they've sold to different countries. And that's important for us to make sure that we have accurate supply information. We keep the manufacturer information strictly confidential and only use it at an aggregated level so that nothing manufacturer specific can be ascertained. Even if there's a market with only one or two manufacturers, we would make sure of that. And that's really key for us because we know that manufacturers really trust us. And we take that very seriously to make sure that whatever we put out there is for the greater good of the market and access, but is obviously respecting different roles of different stakeholders. So you can see that the manufacturer surveys as well have been quite an evolution. So we contacted 129 manufacturers last year, for example, and we got 46 responses, which was actually the highest since the start of the initiative. And I think what's key to note here is that although it's sort of, let's say, it seems like a third of the number of manufacturers we reached out to, the volumes that they captured represent 80% of global vaccine sales. So we think that the samples are representative. Having said that, and I'll be speaking a little bit more to the work we're doing this year, we think it's really important to make sure that we're not just capturing data from high volume manufacturers, that we're capturing representative data, especially from the African continent, because that is so important to focus on and make sure that we understand better and that it's clear and tracked and grows over time, right? That's the goal. So I think this year it's more critical than ever that we start here. And of course, every year we hope to get as much information from every manufacturer as possible. It's not always possible, but we're really, really appreciative of what is possible. And we're also looking to see how we can do better to make it easier and more straightforward. So we will always also look to hear input from you as we go through this. So here, just to give you again a bit of a sample of the data collected to date, again, not including AVMI, but you can see that in terms of the response rates, we had higher response rates in terms of the numbers of responders as a percentage from DCVMN, I think, which is great. And yeah, I mean, on average, you know, it's kind of even across both groups on the percent responded or not responded. So I think this year, again, just to share a bit more about, you know, what we do with the supply information and why it's critical to us. So as I mentioned, when we develop, you know, antigen-specific deep dive studies like we did for RSV last year, we want to be able to not just talk about the demand forecast, but also the supply forecast, and through that, the potential gap. And we really recognize that what we put out there can send a signal to the market. For example, when suppliers see the supply forecast, they're like, ah, okay, that's the size of the market, right? So we're really thoughtful and conscious about it. And what we want to do is make sure that we have the data from suppliers on their own products portfolio and supply. And we always go through a series of consultations with suppliers and ask them to review the work to make sure that it accurately captures the full picture. So for us, it's not just about the data from suppliers, but the consultation process throughout the development of the supply forecast, as well as the finished product, which we always send in advance for review to make sure that what we put out there makes sense, basically. And in 2025, I'll talk through the market study that we're doing this year, where we really think, again, because we'll be diving into regional setups, we think the AVMI reporting is, of course, key to help inform that. And again, the product data, so not only does it contribute to antigen specific, but we do cross-cutting studies like the Global Vaccine Market Report. And there, you know, it's really key to make sure that we're capturing as much of the market as we can. And we know, you know, when we're asked to provide our expertise or advice to SAGE on what's happening in a vaccine market, or to capture what key access issues are in various fora across the board on specific antigens or in specific regions, then our understanding through our internal confidential data set is built upon that, and it makes sure that what we're saying needs to happen is based on information from you as well. So we've also surveyed manufacturers in the past, asked them how they use our MI4A information, because we also want to make sure that we collect data and we know how useful it is to us, but also how do you use it? And, you know, that can also help us improve and do things differently. So I think we've heard from manufacturers that it's helped improve their understanding of vaccine demand, which of course is key. It's provided visibility into global vaccine pricing, which is also quite important. It's helped with internal planning. It's improved their understanding of global supply, obviously maybe with competitors or in other regions. And it's helped, you know, understand characteristics of different vaccine products as well. So those are just a few examples of how we hope you would find the MI4A information useful. Now, just to quickly jump into what we're planning to do this year. So this year we were asked to do this by we have a technical advisory group on market access to vaccines. It's a group of independent experts who have no conflict of interest in vaccine markets and who provide WHO with advice. And they help us prioritize which markets we should focus on every year. And they had recommended that given the current focus on the regionalization agenda, and given that WHO has a global data set, it would be really good if we could put more information out there to help support understanding and decision-making of other partners and member states, and leverage the database we have to come up with a thematic cross-cutting study. So what we're planning to do is, and we haven't got a good name for it yet, so ideas are welcome. We're just calling it a landscape for now. It'll be a global report that captures a breakdown of the region of manufacturing and procurement to better understand the current global supply chain's geographic distribution. Now, normally we've had information from suppliers on their headquarter location, and then we have information of where the products are purchased, right? So we have the procurement and manufacturer headquarter. We had also been gathering from suppliers a bit more details on drug substance, drug product, finished product, but we weren't capturing it systematically. So now we are systematically going to ask suppliers for that information. And we think it's really key to understand the geographic concentration of the full supply chain, right? And this is especially important when you're thinking about technology transfers or strengthening capacity in one region, to understand where the region's current reliance and dependencies are, and understanding the complexity of the supply chains involved. So we think it's really a valuable piece of work in the current ecosystem, and given the focus on increased regional manufacturing. So I think, as I said, this will help us understand the concentration, dependencies, and what's at stake, what's needed to actually shift the manufacturing procurement landscape, and also where are the access barriers and opportunities. And so this work will build from both our country and our industry data set. And of course, it's information that doesn't yet exist globally published. We will, of course, again, be publishing information at an aggregate level, but we think it could be really useful. And we want to also then, once we've started this, use it to help understand trends over time, and to inform also understandings related to routine versus outbreak manufacturing supply chains, and also concentration and preparedness. So this is a little bit less relevant because the from is not relevant to you because you were not providing us with data. But just to say that to do so, we are actually changing a little bit our requests to companies. And of course, for you, what applies is the to. So we're asking suppliers to provide information on all the vaccines in their portfolio. Until last year, we selected 33 priority vaccines. And we're also asking for information about the location of drug substance, product, etc., at the product component level, whereas in the past we asked it at the product level and not in the same granular way. And we will also be asking information about tech transfer. As always, this year, our team at MMGH, who we rely on and work closely with, they have a confidentiality agreement with us. So really just like being a part of WHO, has pre-populated the information where there is information publicly available, or where for suppliers we've already been getting data from, they've already given us information. So in your case, I think this is less so, but Adam will give you a sense of what this means for you. So then this is my last slide, just to say, I think the survey was shared on April 15th by my colleague Georgios, who, as I said, unfortunately couldn't be with us today because he got his travel dates wrong and is on a plane midair. We asked Kate, our director for IVB, to also please, as every year, write a letter that explains the value and the importance of your contribution and the obviously the appreciation from us for having this webinar. And then I think Georgios had asked for you to respond by May 1st, which is a bit short, especially if it's a new for you. So we can certainly extend the deadline until 15th May for sure. And if you need more time, or if you need to have bilateral discussions with us to help you, we would be totally available. For us, it's more about, making sure we can start to get the information from you. And of course, we expect this to be a multi-year partnership over time. So I think I'll stop there, and let me see if I can stop sharing. Yes, I think I've said quite a lot. And then I think, Adam, you can either, we can stop for questions, or we can also let Adam go into the details on what we're asking for. What do you think is best, William?
So I'll ask Farah, you have any words, any comments? Adam, you wanted to add something, Farah?
Hi, no, I think thanks for this. What I had hoped was exactly this, that we get a brief overview as to what it is and why it's important. And so from my perspective, I think this is a good start. I don't see any hands, and I think, Tara, you'll need to give them time to just get familiar with some of this. I think what's going to be important is the consistency of updates. And so we as AVMI will also work to circulate whatever comes from your team. And I'll keep the group updated in terms of the discussions that we have on some relevant items. I think, one of the things I would like to just ponder on with you and the team is how we can work together to sort of inform messaging to the various EPI teams around the markets within the continent around just the emphasis that needs to be placed on zero-dose children and coverage of normal EPI vaccines versus the introduction of the newer, more innovative vaccines, which is necessary but is causing even more change fatigue. And so I worry when you look at some of the countries, the coverage rates have slipped across the EPI, the zero-dose children numbers are increasing, and yet when we speak to various EPI, I've now spoken to 3 countries in the last month, their teams, and the discussion is on RSV, the discussion is on sort of new things that are coming, and we're trying to redirect back to sort of the basics. So one of the conversations I'd like to pick up with your team is maybe it's not wholly in your wheelhouse, but then you can help us shape the discussion in terms of, how do we get this message out, because it's a critical one. But that's just one of the sort of touch points. I think the second one that's very interesting is the market data. I'd like to really urge those colleagues that are on the call to really support with what data you have. And at this point, we might not have any data, but I think then let's share that this is our company, this is where we are in the process. We are staying close to the information that you're disseminating. And when we have an update on our pipeline or when we have commercialized projects, so it's starting at the very beginning now for Africa. And I think the ask is that we participate and collaborate and share what we have and also disseminate the information that's coming to us from this team. So I think those are some of my thoughts at this point. I'd like to see if there are any other comments from the group. Otherwise, I think that's it for now, Tara. Any sort of closing comments from yourself or Adam?
I think, I'm sorry, it wasn't clear. Adam was just going to really quickly, because I think it's okay if we have 5 minutes.
I'll go into the detail of the ask.
Well, yes. You just projected a little bit because, even though, let's say, we work in data, it can be a bit confusing. So Adam, please go ahead.
Thanks, Adam.
Okay, let me just share my screen. Let me know when you can see it.
I can see it.
Yep.
Yes.
Okay, great.
Oh, I'm thinking it's good that you're doing this, Adam. Yes, let's see what is all of
Yeah,
this.
so I mean, I won't go through line by line with the template, but when you open this, what you'll see is there are 5 tabs. The first tab is a list of definitions where we define each of the variables that WHO is requesting information about in the subsequent tabs. There are basically 4 areas of information that WHO is interested in understanding regarding the vaccines that you're developing or the vaccines that you're producing or the tech transfers that you're putting into place. And the first section is really just general information about the product. And so in the product information tab, what WHO wants to understand is, information about the name of the product, the antigens, what kind of formulation, the general indication of the product, the presentation that the product is planned to be produced in or is produced in today. As well as a few other bits about registration and sort of commercialization arrangements. So that's the first bucket of information. The second is about the manufacturing. And so here, the questions are really about where each step of the manufacturing process takes place for each of the vaccines that, again, you're developing or manufacturing. And what's important for this tab is that the information is being requested at the component level. So for example, if you produce a measles rubella vaccine, what WHO would like to understand is in 2 separate rows where the measles antigen is produced and where the rubella antigen is produced. And so, because for certain vaccines with different companies, they may have different arrangements for each of those components. So that's the second tab. The third tab is really focused on what WHO calls available supply for commercialization. And what that essentially means is the number of doses that you plan to make available for sale on the commercial market in the next 5 years, an average. And WHO is asking for that information at sort of the product level. And again, we know that these numbers can be commercially sensitive, and there is sort of a strict confidentiality process in place to make sure that the only people that see this information are really Tara, Georgios, who cannot join us today, myself, and maybe one other member of the MMGH team. This information is not shared publicly. It's always aggregated at a product level across all the manufacturers that provide WHO with data. And is used, as Tara was mentioning earlier, to help us understand the supply dynamics within certain markets when WHO is doing deep dives on those, for example, through these market studies, but also to help us validate the information that countries report. Because if countries are reporting that there are way more volumes, that they're buying way more volumes in a market compared to what we know manufacturers are able to produce, we have to do some triangulation and investigation there to figure out what the truth is. The last piece is product registration. And so here, what WHO is looking to understand is which countries for each of your products is the vaccine registered, or is it distributed by someone else, or is there registration planned? Again, we know this information can be sensitive, especially when thinking about future plans and regulatory strategy. But this information is really helpful for WHO in order to understand what kind of access risks exist in different markets. For example, if a given country only is a big procurer of measles rubella vaccine, but only has one measles rubella vaccine registered locally, then if there is any issue with that vaccine, they risk stock out and supply issues because they don't have an alternative supplier that they can turn to with a product that's registered locally. So again, this information is not shared publicly, but it is used to inform some of WHO's access strategy work and some of the proactive things it does to work with countries to improve their local access situations. So those are the 4 tabs. If you have any questions as you're going through this and trying to figure out what the right level of detail is, please do not hesitate to contact me. I'm happy to set up a quick call to chat through things. Normally we'd like to give examples of this stuff. Maybe we should have done that for you. Some of the manufacturers in AVMI have participated in this initiative before, and so we'll have a good sense of it. And just to say that in future years, once you provide the initial information, when we reach out to you again next year, all of these templates that we share will be pre-populated with the information that you've previously shared with us. So it becomes much more of an update and review rather than the sort of time that you have to put in now to provide all of the initial data. So hopefully the ask and request becomes a lot less intensive in future years once this initial step is passed. I'll stop there and see if there's any questions. But again, don't hesitate to reach out as you start to work through this.
Thanks so much, Adam. I think, William, if I could just make one more comment, I think it's good that you went through that, but also just to be cognizant that we still import 99% of our vaccines. So the information that you're going to get is going to be very sort of, this is our pipeline and our plans. But I do think, as I said at the beginning, it is a starting point. I think if we specifically focus on those that already have been identified as sort of being the first phase, that could be a start, and then build up from there. I just also wanted to reassure the colleagues, William, that this information would go from them directly to the WHO. It's not going to bypass AVMI, because obviously, whilst we are friends, we are competitors. I call it competimates. So as competimates, you will send the information and work with this team. I think our role was just to facilitate the introductions and the ongoing updates and sort of, general catch-ups over the year, etc. So yeah, I think good from my side, Tara. I think everybody is thinking about it because I don't see any hands, and usually there are many hands. Farhan, not even you. You don't have a comment or a question?
Thank you very much.
Right about on time. Farhan, over to you.
Thank you very much. Yeah, thank you very much. In fact, I raised and you answered my question. So that is, thank you very much. The good It is really, I'm excited, in fact, data collection happening because I started my career from IMS Health, where we were having a medical radar, we are having a, blue book and the black book, and now it's turned out to Equa. So, anyways, what I'm looking into is what we are doing is benchmarking the capacity, again, the capacity of the continent of the world, like, okay, how much vaccine in which area, which antigen, and what is the capacity today and what will be the capacity for tomorrow. Because what I saw is manufacturing is a dynamic process and people keep on introducing and deleting. So there should be a trend analysis also you have to do. What I'm understanding is because trends are more important than a snapshot, because in snapshot you can get one data and next 6 months the data could be changed. So if you continue this journey for quite some time, so it will help us basically to understand that okay, we are at certain level, because in last month when we were having a tech transfer meeting, I was suggesting Africa CDC to develop a database where they should basically allow all the tech transfers which are happening to be registered at Africa CDC. Because if we are DEK is having a tech transfer with any DCVMN country, so that tech transfer should be registered and should be now understood that okay, in every 6 month what is our level and when is going to mature. So this will help basically Gavi to basically help them to put our product in their pipeline, that they can estimate that okay, we started a tech transfer in 2019 and now in 2020 we are going to we have reached 50% and 2030 we will be completing, so our product could be available in the market. Because WHO pre-qualification is one of the very big subject, and benchmarking it, you will be understanding that actually in 2030 and in 2035 how many vaccines will be WHO pre-qualification through this process. This will give you the reliability, and also for the WHO PQ team it will help them basically to understand that with this pipeline, how many products will be approaching for them in which year for the PQ. So they can allocate those resources on those times. Like if they understand that DEK 3 products are coming in 2029 and we tell them from 2025, it will be very, very helpful for them to basically develop some resources at 2029 available, make the resources available so that we can get it in time. And that could be one of the very good success of this database which we are developing, and very excited, and we are really up to help you whatever you want data from us. Thank you very much.
Thank you so much, Farhan, for those comments. I think it shows how AVMI itself, could get work with Africa CDC and bring us all together and help contribute to these data gathering, processes. WHO, Africa CDC, even the new RVMC. Michael, Luciola, I see you online. You want to make a comment from the collaborative, Michael?
Hi, William. I think he's dropped off.
So, Dr. Nasidi. Dr. Nasidi.
I think he dropped off as well.
William, why are you chasing the people? Let them go and have an Easter weekend, William.
Dr. Nasidi is our former chair, so once he joins the webinar, we need to acknowledge him and appreciate that he's still active in the AVMI. Okay, so I guess that was very, very elaborate. Tara, we have the recording of the webinar. We will share it amongst our members. You'll also make the slide sets available, your set and also the one from Adam. And we will remind our members the value of the exercise and ask them to contact you directly so that we can get as much information into the database and be proud that the next time that the summary is being shown, it will not just be IFPMA and DCVMN, but also there will be AVMI featuring in the analysis in bold letters. So I do encourage our members. We will remind them and we will work hard Farhan has already promised that DEK's data will be shared. So we will be hoping to see how DEK's forecasts actually, help shape the market as we go along. We also encourage Atlantic Life Sciences in Ghana to also do the same. And I know Simon is online, so we also have our Nigerian colleagues. BioVac is already online, and try and get as many of us to also contribute. Okay, I think if there are no other announcements,
William, can I say
yes.
something here? Sorry for that coming up late. Besides the manufacturers who are basically trying to manufacture the vaccine within continent and outside, there is a supply chain, cold chain supplies, and some vaccines came into Africa which are unregistered. Like Gradacell 9 is not registered in Africa, like in Ghana, but I can see the Gradacell 9 available in the market. People bring it, and there are some cold chains which are basically bringing the vaccine and the biological products in the market, and same might be happening everywhere. So that is also taking some of the market segment. And like yellow fever, I saw that okay, most of the time that is available, and people used to go and buy those vaccines. Those data need to also be to be captured, that okay, in the private market, how the private market is emerging, because initially vaccines were only in the public market. Now there are emerging market which is basically private market, which can be developed through the public awareness campaigns of HPV and cholera, one of the example. And then the second thing is the high cost medicines, like high cost vaccines like Gradacell 9, which is $200 per dose. It will never be supplied in the public sector, it will be going to the private sector. So who are the doctors who are basically trying to push it, that they need it? And so that data also need to be considered, because we also want to understand, and I think WHO also want to understand what is the private market in this whole of the sector.
Okay, so thank you very much, Farhan, for bringing that up. It's a pity that the National Vaccine Institute CEO is not online, but this is one of the things that the National Vaccine Institute in Ghana has identified, and is trying to set up a vaccine database which covers not just the private sector, not just the public sector, but also the private sector, and not just human vaccines, but also animal vaccines. So I'm glad you've mentioned this for Ghana, and I know that it is already a national project that the National Vaccine Institute will be doing. And I think that from AVMI, we will encourage, Ghana to do this. And then we could probably, use this as a model to share, across the region, especially with Africa CDC, so that all this relevant data will also be captured and encourage, sustainable vaccine manufacturing across the continent. So back to Tara and Adam, any closing words, remarks that you would like before we close the webinar?
I mean, just one question to Adam. Of course, if suppliers supply the private market, then can they indicate that to us in the Excel sheet, right? Because it would obviously be another supplier. It's not an African supplier, but I'm just wondering, yeah.
Yeah, there's a comment section where you can provide that detail.
Right, okay. So yes, so I guess just to say that we haven't focused on it, but in theory it is something we could be capturing, and I think that's a good idea for us. So I just wanted to say really a huge thanks again, really, to William and Farah for organizing this for us, for being such great thought partners and also supporters of WHO's work. It means a lot to us, and really it's important, and we look forward to continuing the collaboration. I'd also like to thank everybody who joined the call. Thank you so much for your really great ideas. I think as we saw in the call, yes, we talked about the data collection, but I think all of the ideas coming up were actually related to what we can do with the data and what it means, and how we can actually shape and influence vaccine access. And that's really what's key for us as well. So thanks for your thoughts and ideas, and we'll take that into account, and we want to continue to take that into account. So, at any time you can reach out to us if you have thoughts or ideas about what WHO should be doing or things we should be considering. And likewise, as you know, Farah, you're invited to our technical advisory group to make sure that AVMI is represented. And yes, we're looking forward to having a new graph at the end of this year that has AVMI on it represented. So we really understand it's early and there may not be much data. But again, just starting now, why wait? It's really important for us. So really happy to have this early collaboration and for your support. And as Adam mentioned, you'll see in the email from Georgios, and I think Adam and I are copied. You can just reply to all of us, and we're really happy to jump on a call and discuss. And we're really excited to start this journey with you. So thank you so much. Thanks everyone for your time. Thank you, Adam, as well, for your great input. And wishing everybody a very happy long weekend. If you have one, we do in Geneva.
Thank you so much, Tara, William, everybody.
As we close, I think that we are going to arrange another webinar, because when you show that the value of the data and the analysis that the previous surveys have shown, I think the value was so clear. And we would like to have another follow-on seminar so that our members can appreciate exactly what the M1 information is all about. And really, so we'll work with you and Melissa. Melissa will work with us and arrange a time that is suitable for everybody. Probably